Hello everyone, my name is Nyaku Ebenezer and I welcome you to my YouTube channel. I'm level 400, a medical biochemistry student of UAS. I'm here to discuss with you what is diabetes, what is the causes of diabetes, and what are the complications of diabetes, and how can you manage diabetes. Now let's walk into it. When you say diabetes means that there is high level of sugar in your blood, whether you are fitting or not. Dive into it. So type 1 diabetes, that one is happens to children who are normally infants, so they are born with it. So it is as a result of genetic factors. So their pancreas is not able to produce enough insulin for their cells to use it to pick up glucose from the blood into the cells for them to utilize it. So when it happens like that, means that these children has to depend on insulin. They have to be given insulin anytime they take in food so that their cells can pick up the glucose and use it. The type 2 diabetes, this kind of diabetes happens to older people. This is as a result of genetic factors, as a result of age, as a result of disease, as a result of personal habit, as a result of the malnutrition. So when the person is taking excessive alcohol, when the person is depending on cigarettes, or when the person is having problem with the kidney, when the person is having problem with the liver, these all factors come together to cause the blood level of glucose to rise. Diabetes, it happens to pregnant women. So as soon as they get birth and then you take their blood sample, you realize that their blood glucose has increased. This is as a result of the pregnancy. It is a short period of time after they deliver. The blood sugar will go to normal level. This is what we call the gestational diabetes. It is normally a short time period, so it doesn't keep long. Complications of diabetes. So when a person is having diabetes, what do you normally see? What happens to the person? What can diabetes cause? So one, it can cause increased level of blood sugar, causes accumulation of fatty acids in the blood vessels. Now, so the accumulation leads to plaque. So the formation of the plaque blocks the movement of blood from one place to another. So when it happens like that, some part of the body will be lacking oxygen nutrients because the blood is not flowing to that part. So in that case, when it happens in the brain, we call it a stroke. When heart muscles, we call it a heart attack. Also, increased level of blood glucose can also cause renal diseases and then liver diseases. It can put pressure on the liver and then the renal. So when it happens like that, as time goes on, your liver cells will weaken and then renal cells will also weaken. So the function of the renal will also decrease. Now let's talk about management of diabetes. Let's say you have diabetes. So how are you going to manage it? There's no need for you to panic. There's no need for you to be complaining. One, you have to exercise a lot so that your cells and then your liver and the renal cells can work properly. Two, you have to be taking more nutrition food, taking balanced diet. And then three, you have to take your drugs serious. When you go to the hospital, give you medication, try and then take them. Let's talk about the prevention of diabetes. So as you are a young guy, as you're a young lady, and you're growing up, yes, old age can catch you up and then genetic factor can affect you. However, there are some factors that you can avoid. Let's say taking much alcohol and not doing exercise, not taking proper food. You can be going to the hospital for regular checkup to make sure that your blood. So one, we talk about what diabetes is. Now it means that hyperglycemia, meaning that your blood sugar level is high. We have types of diabetes. You have type 1 diabetes, type 2 diabetes, type 3 diabetes. Type 1 affects children, type 2 also affects older people, type 3 also affects pregnant women. Now the complication of diabetes is it can lead to kidney disease, it can lead to renal disease, it can also affect your heart, it can also affect how your brain functions. So the management, you have to be regular exercise, you have to take proper balanced diet, you have to also be going to the hospital for regular checkup, you have to take your medication serious. So now if you have diabetes, don't worry, you have to do more exercise, take your blood serious, and then also be doing more exercise. If you don't have diabetes, to check your lifestyle activities. Sedentary life will not help you. Make sure wherever you do exercise, you take in much water and all that, and then you all be safe. Thank you for watching this video. Share and like. Bye.